Hey, what's up, everyone? Welcome to the Wealthy Dentist Podcast. I'm your host, Ward Powell. And if you're a dentist looking to crack the code on how to grow your practice and dominate in this space, then stick around. You're in the right place. Every week, we're sitting down with some amazing dentists who are doing incredible things in their businesses. We're talking about everything from how they keep their teams loyal and dedicated to how they stay ahead of the game in this crazy, fast-changing industry. You'll hear about hacks like using virtual assistants to free up your time, strategies to make more sales with less effort, and even mind-blowing stories about patents and inventions that are changing the industry as we know it. And it's not just about growing your practice, it's also about finding out what works from a clinical perspective. Whether you're just starting or you're ready to scale to the next level, there's something here for you. So buckle up, hit that subscribe button, and let's dive in. Welcome to the Wealthy Dentist Podcast, Dr. Helina Tessema. We are so happy to have you. We want to talk a little bit about your journey into the dental industry. We're taking a bit of a, I gotta let you know, we're taking a bit of a different format in that generally we get people that have been around for ages, forever, and then they talk about sunsetting or they talk about, middle of the road kind of areas in their career. But we're getting you right at the very, very beginning, and you're one of our first rising stars that we have that I believe is going to be an important part in delivering the message to the entire dental community. And I'm so glad to have you here. How are you doing this afternoon? Well, it's morning where you are. It's afternoon here where we are. Okay, so, but how are you?
I'm doing well. I feel very well rested. That extra hour of sleep was great.
Oh, okay, great. So tell me, what got you interested in the field of dentistry, and what type of dentistry do you practice? I mean, is there a specialty?
Yes. So currently I'm in residency for pediatric dentistry. So I'm in my first year specializing in dentistry for kids. What got me interested in being in the dental field is I've always had a keen interest in healthcare and, caring for others. But for me, a couple of reasons that intrigued me towards dentistry specifically was the hands-on skills that we learn. I'm a very creative person. I really enjoy working with my hands. And so seeing the effects of something that you did and visually seeing the outcome of it is something that really intrigued me. And also the role that dentistry has in improving someone's mental health was something that really intrigued me to begin with, because you can imagine if you're not very confident in your smile, you tend to not really laugh or smile or things that are associated with positive feelings. And so for me, playing a role in having that, kind of making someone feel more confident with their smile was something that really interested me.
Oh, wow. Yeah, absolutely. Are there any other ways, since you're on the idea of mental health, are there any other reasons that you chose to deal with it from a smile perspective?
Yeah, I think for me, it was just understanding how the mouth and like your oral healthcare kind of shapes the rest is also like very much connected to the rest of your physical health. So with physical health also comes mental health. And so I think having that be a gateway to all sorts of different aspects of one's well-being was something that really intrigued me. And that's why I wanted to pursue it.
So you're in the field of pediatrics, right? So, so you're working with the babies. Can you talk about that for a second?
Yeah.
Why did you choose children? They're obviously very impressionable. Maybe that's maybe one other reason why you probably chose this particular area from the mental
Yeah.
standpoint. Can you talk about that a little bit?
Yeah, absolutely. So I'm actually the oldest of four kids. So I've always kind of been around kids. And I'm the oldest on like both sides of my family, as far as like being the first, grandchild, the first child in our family. And so I've always kind of been around kids now that I'm the oldest. So naturally I enjoyed working with kids, but from looking at it from a dental perspective, when I had the option to choose which type of um, dental specialty I wanted to pursue, for kids, you have to imagine that dentistry is very nerve wracking for even a 40-year-old person. And so when there's a lot of foreign sounds and noises that can be made in like the drilling and all of that stuff. And so setting a precedent now early of good oral hygiene habits is going to be something that they'll hopefully like last them for their lifetime. And so if I can have that impression now, making them more aware of like forming these habits to keep their oral hygiene well is going to be something that prevents future dental anxiety. And that's my goal, is that it's harder to reverse all those years of dental anxiety, but it's better to start a good like start now for the rest of their lives.
How about the fear factor with dentistry in the child? What about that?
Yeah, I mean, it is very nerve-wracking. I have a lot of kids. So the scope of pediatric dentistry involves anyone from like birth to usually around 16, 17, sometimes 18 years old. And so, we're very much in someone's personal space. So I think there's a lot of trust that needs to be built. And you have to be able to relate to kids. So you can't just run off and say eight like tooth ABCD, or this is my Explorer, this is my air water syringe. Like, you have to be able to connect with kids. And so if that means you need to know what the kids are, popular dances or popular songs, or know about TV shows. Like, I can sing like songs from like Bluey or Paw Patrol or things like that. And like, you need to do that as a pediatric dentist, so that you need to be able to relate to them. And using language that they can understand is something that's really important. And I really enjoy having an instrumental role in shaping how they perceive dentistry for the rest of their life. So I take that very seriously. That like, I am the first person that they've probably seen, like, have looking at their teeth, and so I don't take that responsibility lightly.
That's awesome. Yeah, that's great. Yeah, and like you said, I mean, you want to take that fear factor away. Maybe we can start a whole new generation of children coming into adulthood that thinking that no, I mean, dentists,
Mm-hmm.
they do not hurt,
Mm-hmm.
do not hurt us, because
Yes,
I mean,
exactly.
I hear that so much, not just from, dentists saying that's a myth,
Mm-hmm.
but then, the general public they're always talking about, oh man, I got to go to see the dentist. I don't want to do this.
Yeah,
I'm going to go on and admit it. I was one of
yeah.
them at one point in my life, but that
Mm-hmm.
soon changed over time.
Mm-hmm.
But yeah, so that's great. So as a pediatric dentist and or as a resident, what have you learned at this point? Because I know when we start thinking about the time frame, you might have had a situation with the COVID, right? And
Mm-hmm.
I was going through that. And now that you're now past that, you're in residency, what was that experience like? Because I know people have not really heard a whole lot about that particular aspect of, of their, their challenges, if you will.
Yeah, no, definitely. COVID was something that restructured so much of my dental education. Um, for starters, I think it's interesting to first note that there's so much of dentistry that is hands-on. You cannot just read a book about teeth or preps or restorations. You have to actually do it. And so you could read as many books as you can, but being able to pick up a drill, even the way that you sit, the way your back is, the way your eyes are like focused on an area of the mouth, like all of these things are just things you have to do in person. You cannot read a book about it. You can't do it through a computer screen. And I think a lot of my classmates were very nervous that there was 200 of us in our class. And I graduated from Tufts in May. So Tufts is in the major cities in Boston. It's one of 3 dental schools in the city of Boston. And so being in a metropolitan, or like choosing to go to a dental school in a metropolitan city where we were in the hub of downtown Boston, and 200 students from all over the country and all over the world realistically could not just congregate in one building to be able to do this. And so a lot of our classes were rearranged so that most of the didactic portions were put on the front end of our schedules. And then as things slowly got open, we started like in shifts being able to go in person and practice drilling. And for any starting dental professional, like it's muscle memory. So a lot of us were a little discouraged at first because we were like, how are we supposed to learn the fundamentals of dentistry over the laptop or over like a screen? And so thankfully in the end things did work out. We were able to all complete our requirements and graduate on time, but it was very nerve-wracking to think about how is like, because I started dental school August 2020, so it was probably like 4 months since everything started getting shut down. So it was very nerve-wracking, but I do think to an extent there are still some of us, and myself included, that may not feel extremely confident in some of our hand skills just because we did not get as many reps as we would have wanted, maybe than some of our older alumni. But being in a residency now is something that I do want to make sure I still get my reps in so that I feel more confident with my preps or my extractions and things like that. But yeah, definitely, I think COVID took us for a turn that nobody was really prepared for.
Well, I know for sure it definitely puts you into a space where, change is always possible. And in your business, in your type of business, there's always going to be change. And with that
Mm-hmm.
said, technology, how are things going there with the technology that you've managed to see while you were in school and now that you're out into the real world, so to speak? How is that
Yeah.
coming? How is that coming along?
Yeah. I mean, I think even when we talk about technology, I think research also plays a role into this because with COVID, um, we had to figure out ways that we were going to still be able to treat patients that reduced aerosol spread. And so I know at our residency program, there was like research that was done to understand whether, like, for example, so SDF, silver diamine fluoride, is a product used to arrest lesion cavitations. And it's a very popular tool to use, but it is one option that was used a lot during COVID to at least arrest the cavities that were growing, rather than having to have a child come in, use a drill, expose them to aerosols, and expose the provider. So basically, it was a way to put a band-aid on the situation. And I think like even being exploring like those different types of options was something that we had to adapt to. And so with like your question about technology and also just research, like we had to learn how to adapt and how to be creative to be able to treat kids that clearly needed the help with it, but we couldn't consistently just drill in and produce all these aerosols that was gonna put everybody at risk. So being creative with our treatment options is something that I feel like a lot of us also gained as providers. So now we can think about other ways that we can treat patients other than traditional drill and fill.
Yes. So now that you uh, well, you got a little ways to go, but I wanted to I wanted to at least hear what you have to say about, the possibilities of you opening your own office. Is that something that's on the table, or are you looking more so into the field of academia? Where are you going with that in the next,
Yeah.
I guess, 5 to 10 years?
Yeah. I alternate. Some days I want to have my own practice, some days I don't. The one thing that I'm pretty steadfast on is I definitely want to have a career in academia. I really enjoy teaching, and having a role in shaping the dental education of future professionals is something that means a lot to me. I know the role that so many of my mentors and my teachers have had in my life, and I to this day can still like fondly remember things that they've taught me, and I want to have that. I want to give that back to the next generation. So in some capacity, I do know I want to be in academia, whether that's like a part-time or full-time professorship at some point. When I think about where I want to practice ultimately, it always requires that it's near dental school, because I do want to do that at some point in my career. But for ownership, I think it depends on the day, how I'm feeling.
Yeah,
So,
okay, okay. So
yeah.
that's sometimes you're on, sometimes you're off on it. Oh,
Mm-hmm.
okay. All right. Well, hey, that's fair. I understand. I understand. It's quite a juggling situation when you're trying to be really good in the clinical aspect of the business and
Yeah.
then to be a CEO or a CFO in the business as well. That's quite a juggling act, if you will.
Yeah.
Have you thought about? Okay, so you did mention that you have mentors. So I
I
mean
do.
that's great. I mean, how many do you know offhand how many mentors do you have, and what encouraged you to grab mentors, and do you have like a study group even today to get yourself acclimated to um the new skill or a new um piece of software or hardware. I mean, anywhere you want to go with that, you can just fire away.
Yeah. For me, I have two mentors that I can think of off the top of my head that have played an instrumental role in getting me to where I am. And first one was I met at a dental conference while I was in college still. So this was the Hinman Dental Conference that comes every year to Atlanta. And so I met a dentist there who basically took me under her wing. Once we connected, I remember like I got her number and it was an area code where I grew up in LA. And so I was like automatically, I'm like, oh my God, wait, like, while I was living in Atlanta, I really missed home. And so I didn't get to go home to California too much, but just even the mere fact that somebody was from the same area where I grew up was an instant connection. And so then she's encouraged me to reach out once I would go back home for like the holidays or summertime. And so she helped me a lot with my dental school application process, and guiding me through all of that. And then while I was in pursuit of my dental school application, I reached out to pediatric dentists that were in Atlanta, who I could also seek mentorship from, because I always knew I wanted to work with kids. I wasn't. I still wanted to keep an open mind, and even in dental school, I did try to keep an open mind to make sure that I explored all my options. But working with kids still really spoke with me, and so I remember one day when I was in college, I went to a computer in our computer lab and I just Googled like pediatric dentist near me. And so I looked around for any pediatric dentist office that was willing to um, have someone come and shadow, have someone intern with them. And they also had to be somewhere where I could commute to. So whether it was like walking distance or I had to take the train. And a lot of them said no. And now being on the other side, I understand there's liability issues. And so I'm like now knowing what I know now about how to like run dental offices and how like practice management and things like that. It can be a little nerve wracking to just allow a college student to come in. But the one person that did say okay was a pediatric dentist that was probably from where my dorm was. It was an hour and a half commute on the train. And so I remember, but he was the only one that said yes to me. So I said, okay, I'll do it. And so then I remember commuting like two trains to be able, and like two trains and also walking to get to his office. But he immediately took me in. He taught me everything that he knew and was so gentle and so kind and very, just he saw a lot of potential in me and poured that into me. And I'm to this day, I'm so grateful for all of that. And she just showed me how to be an effective pediatric dentist and things that I still think about while I practice today. So those two mentors to me have played such a big role in where I am now. And I want to just reciprocate that for future dental leaders. And that they're a big testament to how I got here.
That's great. That's great.
Mm-hmm.
How about the group aspect?
Oh yes,
Yeah.
yes. So yes, I do still get to speak with like my friends from dental school. Not, some of them are in different fields, so they're not pediatric dentists. Like I have friends that did general dentists or doing ortho. And so it's always interesting to catch up with them and see what they're doing, how they're managing. Like I had one of my friends, she's doing ortho residency, and so she deals with kids that are a little bit older, but still there's behavior management that needs to be taken into consideration, not so much as like young as the kids that I deal with. But I remember texting me and she was like, how do you keep these kids' mouths open, like what do you use? And they're almost gonna bite me. And I said, oh no, nobody bites me in my chair, like we don't do that. And so then I kind of showed her the tricks that we use and the equipment that we use, and I said, go ask like your like the people that provide all the instruments, like see if they have this instrument or see if they have that. So yeah, we always get to connect, and that's great.
That's awesome. That's awesome.
Mm-hmm.
Okay, so these are so like there's like you don't have like a group, a cohort that actually go in to like say a conference and grab some information and then you all dissect it and work with it together and figure out the best way to learn it together. I mean, do you have anybody out there like that or a group out there like
Um, yeah, well, it's still a little too young for us. I haven't gone to any dental conferences now that I'm a practicing dentist. So I know our annual like pediatric dentistry conference is coming up at the start of next year, as well as the one for the California Society of Pediatric Dentists. So I'm hoping to go to those ones at the start of
okay.
next year. So I haven't been there yet. So I would
Okay.
be. Yeah.
Okay. All right. All right.
Mm-hmm.
Great. 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 Because just from talking to, I mean, dentists that have been studying and practicing for many years, they still have a little cohort, where they
Yeah. Yeah.
kind of get together and they learn what they need to learn, and everybody takes a piece of it and present, and I thought that was, team learning, group learning has always been something great for me anyway. So
Yeah. I definitely.
yeah, go ahead.
No, I was just gonna say I would definitely love to go to like PE courses or conferences or things like that where I can learn. Um, that's like the big thing about our field. There, you never stop learning. You never know everything. And putting yourself back in a student position is something that we should be comfortable with. Like we should never just be complacent and repeating the same things that you've known for because it worked. Like no, there's other ways. And so being a lifelong learner is a part of being a dentist. So I'm
Absolutely.
excited. Yeah.
Absolutely. Totally agree. So,
Mm-hmm.
where do you see yourself in the next 10 years? I mean, I know we spoke a little bit about, um, you know, how you feel about teaching or, mentoring, and maybe not so much being the business person. Or, I mean, it's not out of the cards, obviously. I mean, you kind of made that clear. What do you see yourself in the next 10 years?
In the next 10 years, I see myself being working as like an associate at a dental office, preferably like a family dentistry office where the whole entire family can come in and get work done. So the kids come with me, the adults go, the parents can go to general office or endo or any oral surgery, kind of like that. And then also having a part-time faculty position at a dental school nearby. So that's
Oh,
what I would
okay.
envision.
So you want to be relatively stationary. I mean, I guess that's what I was getting to. You want to be relatively stationary because I know there are other specialists that I find they're all over the place. Like, they might be
Yeah,
in one day and another state the next week,
yeah.
and so forth and so on, because they did not want to take the route of being opening up their own practice. And if they did, they wanted to be, ran by someone else that they hired. And I've known,
Mm-hmm.
like I said, I've met and talked to dentists that spoke like that, and from that experience anyway. So I'm wondering, is that that's not something that you kind of looked at, or something that you're not necessarily interested in? You want to stay pretty stable or
Yeah, yeah,
stationary, as you say.
yes.
Okay, well, hey, I totally
But I'm
understand.
open.
Huh?
I'm open. I'm not going to say no to anything now. I think I'm still young in my career, so I'm open. But that's where I would see myself.
Yeah, because I mean, I remember you saying you started in LA, then you
Mm-hmm.
went to Atlanta, then
Mm-hmm.
you went from Atlanta to Boston,
Mm-hmm.
and from Boston to San Francisco, right?
Yeah,
Right?
I'm a nomad. Yes, yes, you got it all right. Yeah, I I I think part of my earlier life, I was very into getting to explore different places. And I'm so grateful for all of those. Like I loved living in all these areas and learning so much. But now I think I've done enough perusing, and I'm ready to go back to where I came from, which is LA. So
Okay. Oh, you ready to go
yeah,
back to LA once you're
yes,
done with?
ideally,
Oh, okay.
ideally, yeah.
Okay. All right. Okay.
Hmm.
Well, that's a
Hmm.
big state. So,
Yeah,
yeah, I mean, city, state, California. I mean, it's just a big place. Okay,
yeah.
so then, you figure that you're going to be somewhat of an associate, and that you want to look at possibly being on someone's faculty. That's
Hmm.
awesome. I mean, trying to combine those two and not really having to deal with the business part, reading different papers that the students have to turn in each week or whatever. That's a busy week. Being an
Yeah,
associate and doing school at the same time. That's
yeah.
a pretty busy week. So I don't know. How do you envision juggling that? I mean, especially if I don't know if you're looking to have family, uh,
Yeah.
that point, those kinds of things. I mean,
Yeah, no, it's not easy. It's definitely not easy. Um, I I don't know if I've put a lot of thought into exactly how I would manage it. I've always kind of been the place where we'll figure it out, like one way or another, we'll make it work. And so yeah, I can't confidently say that I've thought exactly about how I would want to split my time, but I do know that whether that's like maybe the faculty position is like every other week, and then the associateship is for the most part like 3 days or 4 days, whatever it is. I just know that those are the things that the goals that I've set for myself, and those are the ways that I've seen myself in the next 10 years. And so um, I'm hopeful that it'll work out the way that I wanted to. I try to always be that way with a lot of goals I set for myself, is that, um, I manifest it in a way that it happens exactly how I wanted it to be. And hopefully it works out.
That's awesome, and
Mhm.
obviously you've been able to accomplish all of the things, if not most of the things that you've set out to do. That in and of itself speaks volumes about who you are, your character. You set goals, are set very high. That's awesome. I don't see any reason why whatever it is that you want to do that you can't do it or you won't do it. I mean. It's just a matter of you deciding which way you want to go with it, right?
Yeah, yeah.
So, um, so why, I mean, while you're in your residency, what are you focusing on right now the most? Is there any particular area, any particular work that you're interested in the most while you're practicing?
Um, I think for me, the most important thing I try to do is education. Um, and what I mean by education is when I have a patient that comes in with their family, it's not just talking to the kid, it's talking to the entire family. This is a group project that we all need to be on the same page with. And so empowering the families with the education and the tools that they can use, not just for the child, but also what if the child has siblings or if the child has cousins. Basically, I want to make sure that the time that they spend with me in my chair is not solely focused on the child, like that's in my chair, but also the community around them. And so, what I'm interested in to see is sometimes I'll have like the oldest sibling come in, and maybe they have certain oral hygiene habits that they haven't perfected yet, or there's some cavities here and there. And then I'm curious to know whether or not, like, let's say there's a younger sibling. Now, do the parents have enough information? Are they equipped with enough knowledge to know that, okay, well, when this kid, we didn't know that, we had to brush for 2 minutes twice a day and incorporate the flossing. We didn't know that. But now that we have the younger sibling, now we're going to start with that. Now we're going to make sure that the juice consumption, we don't start juice consumption until like they're a little bit older. Not having them sleep with the bottle of milk at nighttime and like leaving that. So like little habits like that is something that I'm really interested in, because um, I want to make sure that, you know, people learn. And so not just the kid, but like the kid, the parents, me, we're all in this together. And so we're all here to work as a team. And so that's something that I find very interesting, because I do see a lot of families. I do see a lot of like multiple siblings coming in at a time. And so, like I said, I don't take the time that I have with them for granted. And I try to educate them as best as I can in the most effective way possible at an age appropriate level, um, so that they can now spread that information to other people that are not in the chair. Um, Another thing that we find a lot in our patient population is also multi generational families. So we have families living with parent, child, and also grandparent. And while the parent did bring the child to the to the office, parent is not usually there like 9 to 5. Grandparents are there. So it's very important that I also instill the information that, hey, it's not just the parent, the grandparent also needs to know about this too. So like next time, bring grandparent in, we'll all talk to the grandparent, or at least tell them what I'm sharing you, like, oh, here's some brochures, here's this, tell them, because if they're the ones that are in the house most of the time, then they also need to know. So just making sure that everybody's on the same page, we're all working together, is something that I find very important in my time.
That speaks volumes. That is very valuable. You know,
Mhm.
that's great. So, do you give them homework?
I don't give them homework, but I do give them like pop quizzes. So, for example, like I will mention it in the beginning of the appointments. Like I'll say, like I'll tell them, okay, well, we want to, one thing I always like to say is, okay, we aim for brushing twice a day. Depending on how old the kid is, I'll use certain words like quadrants or things like that. But I'll also say, imagine we split our mouth into four. We want to spend at least 30 seconds in each section, and for a total of 2 minutes. And so we kind of do, like, based off their age, I'll be like, okay, well, did you guys learn multiplication yet? Have you done addition yet? So then we go through, okay, well, what's 30 times 4? Or I'll say how many minutes are, or how many seconds are in a minute. So we do like small little quizzes like that, to help kind of reinforce that, we want adequate time. This is not like a 20-second thing that we do right before bed. This is a timed 2 minute thing that we try to go, like, our aim for. So I'll mention that. And then I'll also say, like, let's sing happy birthday 4 times, or let's say our ABCs 4 times, like things like that that they can relate to. Because sometimes 30 seconds, like I don't know if the average kid can quantify what 30 seconds is sometimes, depending on their age. So I'll say, okay, sing your ABCs. There's 26 letters, 26 seconds, more or less. So that's how I try to instill them. And then we'll go on, we'll do the exam, we'll do the x-rays, and then like right before they leave, I'll ask them one more time. I'm like, okay, do you remember what the time was? And so then if they remembered it right, then they'll get an extra sticker, or they'll just like, I'll tell them, like, I'm really proud of you, good job for remembering that. There's like, positive reinforcement, things like that. So those are just like small minor ways that I try to incorporate my lessons in a way that is, they can understand it, and also they'll remember it.
Yeah, that's small, but in a big way, that's extremely helpful. And
Yeah.
that's awesome. And they know they're
Yeah.
going to get a sticker in the end if they get it right.
Yeah.
Yeah,
Yeah. Exactly.
that is
Exactly.
cool. That's so they don't give them
Mhm.
suckers anymore, huh?
No, that's a little counterproductive. But in our office, we do have xylitol lollipops. So xylitol helps with like reducing caries incidence. And so, we do give that. Being a dentist on Halloween Day, like earlier this week, was quite the conundrum, but that was fun. We were all dressed up, but it was also like, okay, if I'm drilling out this cavity right now, why did we get this cavity? Okay, we're eating candy. Oh, okay, but you're gonna go get candy later. Okay, well, at least what are we gonna do? What are we gonna focus on? At least have your candy, but what did we learn today? Okay, let's make sure we clean our teeth, brush our teeth really well tonight. Um, Spreading it, like not eating it like constantly throughout the day. So things like that was our best attempt.
Wow. So that begs the question, since we are talking about Halloween and children with candy and dentistry, I mean, I don't know whether because you talk about research. So here's the thing that I have going on in my head right now. That red dye this, the blue dye that. Do you ever get to study that? Did you have to study that? Is that something that you kind of like talk about to someone that's willing to listen and can understand?
Yeah. I can't speak for that only because I just haven't done enough research on. I know the general harms on it, but I personally have not done like extensive research on it. From my perspective, what we basically just try to emphasize is more natural foods, like the fruits and the vegetables. And even with fruits, sometimes, like, some parents will say, oh, well, like I give them juice, but it's only apple juice or it's only orange juice. And I try to emphasize, okay, well, I'd rather have the kid have the actual fruit rather than the juice version of it, regardless if it says like 100% organic or blah blah blah, whatever. It's still the sugars that are there, and it's still sitting on the teeth unless they're thoroughly cleansed, and that's what's like slowly eating away the enamel. And so I'd rather have them the actual fruit rather than the juice version of it. And so little things like that, but specifically like red dye research, I have not done that, so I wouldn't want to say something that is inaccurate.
Yeah, well, I can understand that. I mean, I was just curious, just we're talking about candy, Halloween, and
Yeah, yeah,
dentistry. I didn't know whether dentists actually studied that or not, that particular area,
yeah,
because I would think it's, yeah, they're used,
yeah.
but I guess.
Yeah, no, there's definitely people that do it. It's just I
Oh,
haven't
there.
done it. Yeah,
Okay.
yeah.
All right. Okay.
Um, so, but yeah, and the way that I always go about it is I always tell kids, I'm not going to sit here and lecture them and say, don't eat candy or don't do this or don't do that. It's more of like, listen, hey, I like candy, I like ice cream, like I like certain things, but it's the frequency and the duration. Like those are the important things. And that's what I really try to drive home is like, I'm not going to sit here and say, don't ever have soda, don't ever have juice. Like they're kids, like they go to birthday parties, they have like fun events. So I always just try to emphasize to the parents, like it's okay from time to time when there's a special event or a birthday party, but let's work together to reduce the frequency of it. Because they're kids. They should be able to have it from time to time, but it's this everyday consumption that is going to be harmful.
Okay. All right. Understood. So
Mm-hmm.
now that you're like in residency and it won't be too long before you're out and about, uh, what would today's you say to the beginning you? In other words, the you that's just starting in
Mm-hmm.
this area of dentistry, studying that is. How would you advise that person or you if you were where you are now, and then you can look back and say something to yourself when you first started?
Yeah. Um, the big thing I would say is, um, well, the thing that I remember I had to always tell myself is don't look left and don't look right. Just look straight. If you start looking around at what other people are doing, you lose sight of what you wanted to do. The only person that you should be looking and comparing yourself to is the person from is a version of you yesterday. Are you doing something better today that you could have done or that you want to do better today that you could do better tomorrow as well? So we're only comparing ourselves to each other, like individually. When you start looking at what everybody else is doing, you lose sight of what you yourself are wanting to do. And I think that stands true for not just dentistry, but everything in life. I think it's very easy to sit and compare. Um, but everybody's journey and everybody's process is different. There's no like that, there's none of us are that alike. Um, and for me, I think when I was in dental school, there were instances when I would be a little frustrated because, for example, let's say I couldn't get this crown prep to look right. And like I would look around my classmates and they were getting things checked off and they were able to proceed to the next procedure. And I was still stuck on the crown preps. Like I had to just sometimes I would have to just take pictures of my crown preps. Like look at my crown prep from last week. Okay, what does it look like today? Is it different? Does it look better? Because ultimately I'm the one that has to do the crown prep, not my classmates. So does my crown prep pass? And does it look good? And so I need to compare my crown prep from the crown prep I did last week. And I think that's something that I've always had to remind myself. And even with residency now, like, you know, you have to make sure that you are doing the best that you can according to like your standard. That's all you can do. I can't look at what's going on in the next door operatory. I can't compare any of that. I just need to make sure that what I do in my chair is the best of my ability. And I'm continuing to do better. So that's what I try to tell myself. And I think another thing is also understanding that dentistry, I mentioned this earlier, is a lifelong learning field. Things are changing for the better. Even when we think about different ways how we like behavior guidance ways that used to be done with kids before. I remember when we were learning about different textbooks, how they would manage kids. And I don't know if you're familiar with like protective stabilizations or papooses or things like that basically just kind of hold the child in place. It's basically like a big seatbelt. And how that was the way that you would get a kid to manage in the dental chair. But now there's so much more like different methods where we can use like our words, where we do voice control. So voice control is something that you either raise your voice a little higher or lower it down so that they're actually listening to what you're saying. There's other positive reinforcement, tell, show, do. Like there's different ways that we do things, and that's only because dentistry has changed. And so being a lifelong learner and being like able to adapt to all the new ways is something that is important in being a great dentist. You can't just keep doing things on how it was done back when you were in dental school. Like by the time I'm a practicing dentist, the things that I did in dental school is going to be so much more different than what I'll do like 10 years from now. So
Well said.
yeah.
Thank you so much for that. And
Mm-hmm.
I guess this is kind of like a conclusion of our little conversation. I
Yeah.
really appreciate you coming out and spending your time and sharing your information, your experience with the Wealthy Dentist podcast. If someone wanted to get in touch with you and, you know, I don't know, pick your brain about your particular field, how would they
Yeah.
do that?
They can email me would be the best way. Um, do you want me to like give you my email
Yeah, yeah, sure.
information?
You could say,
Okay, so I'll say okay. So it's Helina.Tessema, my first and my last name, 24 at gmail.com. And I check that email regularly, so you guys can reach out to me there. But no, I mean, thank you so much. I was so like um I would say I was a little surprised when I first got the invitation to come here because I was like, I don't know anything. I just finished dental school. Um, but I think talking to you has helped me realize, like, okay, I do have something to share, whether if it was at least a pre-dental student or current dental student. Like, there are certain levels that I've finished, and so getting an invitation from something called the Wealthy Dentist, I'm like, I'm not wealthy at all. I am in student loan debt, um, but I do have some knowledge. So I have some wealth of knowledge for certain aspects of this long career, and so you know I am very humbled to be asked to help give my advice and my experience about that. So for any future pre-dental students or current dental students, like I've been at those positions, and so I can at least speak to those. Um, but even being at a platform where there are people that are well into their career, like for me to be able to learn from them is something I'm also excited about too.
well, you said it. You hit the nail on the head. Wealth does not end at dollars and cents. It's just,
Yeah, yeah,
I mean, there's a lot of other stuff that goes with it. You can have a lot of wealth and no health.
yeah.
What is
That's
it going
true.
to do?
That's really
What
true.
good is,
Yeah.
what would that do you? I mean, and then you have all of this information. Yeah, I mean, there are dentists that come on here that have a whole bunch of information, and I
Hmm.
appreciate that. But you're going to resonate with other people. That the other dentists that have been on
Hmm.
this show have not been able to resonate with. So there are different levels of
Yeah.
information being transferred from people like yourself, like
Hmm.
the other wonderful dentists that have been on the show or
Hmm.
podcast, that people are ready to take in and use it to their best ability. And I
Yeah,
appreciate taking the time and doing that.
of
You did a
course.
wonderful job. Thank you so much.
Thank you. I appreciate it. This is a lot of fun.